Do you find yourself often worrying about things that might happen in the future? Do you ever feel tightness in your chest that makes you think you're having a heart attack? Have you ever experienced feelings of impending doom even though nothing is wrong? Have you ever wondered if you're going crazy because you're so anxious? If you answered yes to any of these questions, you may be suffering from an anxiety disorder and not realize it. According to the Anxiety and Depression Association of America, anxiety disorders are the most common mental illness in the U.S., affecting 40 million adults. Yet, while anxiety disorders are so common, only slightly more than 1/3 of those affected receive treatment. If you've ever wondered why you are so anxious, stick around to learn more about anxiety disorders and how they can be successfully treated. I'm Dr. Donna Leigh Bliss. With over 30 years of experience as a clinical social worker, I've worked with people with all types of anxiety disorders. I understand how debilitating they can be, but also have seen countless people find relief when they have received treatment. Today, we will explore what anxiety disorders are, including some of the common ones, and what causes anxiety. Finally, we will take a look at treatment options that have been used successfully in helping people with anxiety disorders. By the end of this video, you will have a greater understanding of what anxiety is in general and information about specific anxiety disorders, along with resources you can use to get help for yourself or someone you care about. While occasional anxiety is a normal part of life, as people can worry about many kinds of issues such as work, health, relationships, the state of the world. According to the National Institute on Mental Health, anxiety disorders involve more than just temporary worry or fear, as the feelings of anxiety do not go away, but can actually get worse over time and interfere with daily activities such as work, school, and leisure. Anxiety is a part of life and actually can be quite helpful in improving learning and performance. But anxiety disorders can be quite debilitating and negatively impact the quality of your life. There are several types of anxiety disorders. Among the more common are generalized anxiety disorder, which involves feeling excessive, unrealistic worry and tension with little or no reason. Panic disorder involves feeling sudden, intense fear that brings on a panic attack where you might break out in a sweat, have chest pains, and have a pounding heart. Social anxiety disorder is feeling overwhelming worry and self-consciousness about everyday social situations. This can include obsessively worrying about others judging you or being embarrassed or ridiculed. Phobias are feelings of intense fear of a specific object or situation, such as fear of heights or fear of snakes. This fear goes beyond what's appropriate and may cause you to avoid ordinary situations. Obsessive-compulsive disorder is characterized by recurrent unwanted thoughts accompanied by repetitive behaviors such as frequent hand washing, counting, checking, and cleaning that are done to ward off the anxiety that the obsessive thoughts are generating. At best, these rituals can provide only temporary relief, and not doing them can actually markedly increase anxiety. And finally, post-traumatic stress disorder develops after exposure to a terrifying event or ordeal in which grave harm occurred or was threatened. Researchers don't exactly know what causes anxiety disorders, but suspect a combination of factors play a role, including genetics and environment. According to the National Alliance on Mental Illness, studies support the evidence that anxiety disorders run in families, as some families have a higher than average amount of anxiety disorders among relatives. In terms of the role of environment, a stressful or traumatic event such as abuse, death of a loved one, violence, or prolonged illness is often linked to the development of an anxiety disorder. A common goal clients tell me is that they want to get rid of their anxiety. While this sentiment is understandable given how uncomfortable chronic levels of anxiety can be, the reality is that anxiety is a part of life and actually something we need to learn, grow, and survive. As such, it is helpful to see anxiety as a source of feedback that we need to pay attention to. This becomes more apparent when we see how and why anxiety is created in response to perceived threats. Different areas of the brain play a role in the anxiety response. Anxiety happens when the amygdala, a region of the brain primarily associated with emotional processes, perceives a threat and surges the body with hormones, including adrenaline and cortisol, to make the body strong, fast, and powerful to respond to the threat. Heart rate picks up and breathing becomes more rapid. Muscles tense up. The level of emotional arousal increases. Tunnel vision develops as the brain focuses more and more on addressing the threat. This fight or flight response is common in the animal world as well as for humans in order to help the species survive. Biology takes over this response with the end goal of being able to take some sort of action, such as fighting or fleeing, to survive the threat. The level of arousal starts to dissipate as action is taken, and if successful in addressing the threat, the system returns to its natural calm state. The perceived threat can be triggered by the senses or prior learning. The problem is when the threat is imagined rather than real, such as when someone future trips by worrying about negative scenarios that could happen in the future but aren't happening now. For example, someone might worry about the breakup of a relationship or losing a job at some point in the future, even though there is no evidence this is likely. The fight or flight response gets triggered and the level of anxiety increases in preparation for dealing with the threat. Except this time there is no actual threat to fight or flee, and no opportunity for the energy of arousal to get dissipated by taking action. This lack of resolution after being so aroused is debilitating and can lead to chronic stress and illness. Despite how uncomfortable anxiety disorders can be, the good news is that they are treatable using psychotherapy and/or medications. Psychotherapy involves working with a therapist to reduce anxiety symptoms. Cognitive behavioral therapy is the most effective form of psychotherapy for anxiety disorders. It works on identifying negative thought patterns and behaviors that can generate anxiety in an effort to recognize and restructure them. In other words, cognitive behavioral therapy can help you change how you interpret a situation. It can also include exposure therapy, in which you gradually encounter the object or symptom that triggers the anxiety so that you can develop coping skills and confidence that you can manage the situation without being overwhelmed with feelings of anxiety. In terms of medications, there are several types that are used to help relieve anxiety symptoms. Antidepressants and benzodiazepines are commonly used. Given the variety of medications that are used to treat anxiety, it is best to talk with your doctor about the pros and cons of each to decide which one is best for you. Treating anxiety is not a one-size-fits-all approach. It is common to take medications to help relieve the symptoms of anxiety while working on developing coping skills with psychotherapy. While anxiety disorders are the most common mental illness in the United States, research has shown that it is possible to recover from them so that they are not so disruptive to your life. Take action today to reach out to a mental health provider to learn more about treatment options that are available to you. I have listed some helpful resources in the description below. Remember, now is always the time to take action to feel better about your life.